Hi, everybody. For those of you that don't know me, my name's Billy Shelton, and I am the EMS coordinator, at least for the curriculum here at JCC. Some of you are former students, some of you are adjunct faculty here, but I wanted you to at least put a face with the name that will be de facto in charge of the class. Um, Now, I have to let you all know we've got some technological challenges here at JCC right now because of staffing shortage, like most places. Ours just happens to be in the IT department, specifically when it comes to Jolt, which is student services that goes along with Blackboard and things like that. So, loading content is a challenge at this point in time. Luckily, most of the content that I want to use, I've already had built into the class from previous offerings, but because of the nature of this class, okay, EMS Bridge is supposed to be looking forward, okay, and by that I mean looking at technology, looking at what is coming in the future of EMS. So that's the reason that there's no real book requirement because that book hadn't been written yet. Those chapters don't exist. Okay, you in your practice and profession will be writing those chapters about what's being offered in North Carolina, what's being done in North Carolina, and throughout this class, we're going to talk about some things, and some of the things we've already seen, some of the things you've probably already read articles on. Non-traditional roles of paramedics. The IFAST, um, looking at ultrasound use in EMS, looking at iStats, um, thinking about outside the box a little bit, but thinking about how EMS does research and is it credible research? Because, a research project is only as good as how you set it up. So when you look at the different things that you'll see um, in the course breakdown as far as the weekly lessons, you're going to see some topics that you may have been beaten over the head with through the years, or some of the things that maybe you want more information about. So, non-traditional roles. I don't know if you've ever done a SWOT analysis, but thinking about the state as it is today of EMS, that's what a SWOT is: strength, weaknesses, opportunities, and we're going to look at, what kind of issues we deal with or you're dealing with. And I think, we've got kind of a diverse group of people, some that have recently attained their certification and some that have been in the field for a while. So I'm hoping that the field experience of those that are tenured, so to speak, in the profession can help mold some of the newer people. Um, Now, we're going to talk about psychological aspects of EMS, and throughout the course, what I'm going to have you do. Okay, yes, there's going to be PowerPoints because there has to be PowerPoints. Okay, and I'm going to utilize this platform. Okay, Collaborate, for me to do some voiceovers of those PowerPoints. Now, because of the tech challenges that I'm encountering with Blackboard, if you click the link on the weekly breakdown or the weekly assignments, what you're likely to get is just the PowerPoint. And yeah, you can breeze through it, but it's probably not going to be as comprehensive a deep dive as what I'm going to put in Collaborate. So come back to this section and look for those things each week. Okay, so psychological aspects of EMS, not just um, dealing with psych patients, but dealing with our own psychology, preventing burnout, recognizing burnout, things that are important when it comes to provider well-being. We're going to talk about patient assessment, and there's 2 weeks on patient assessment. Okay, and the first week of patient assessment is how it was taught to you in school. I'm sure, you know, scene safe BSI and running ABCD or XABCD, depending on which assessment you're using. Okay, and that's great to get us started. That's great for a 911 ambulance response. That's great for that setting. But there are a lot of other things when it comes to assessment that we probably need to know. And some of you may already know this. Okay, I'll be honest with you. Depending on how aggressive your instructors were about, teaching, or about how aggressive you are about learning. You may know some of the things that I'll be talking about or be alluding to in the second week, which is a different way to look at assessment. Okay, not just assessing the patient for life threats, but for their ADLs. How well is this patient equipped to stay in their environment? What can I do? What's a different paradigm when it comes to, if you're a community paramedic, or if you have some sort of expanded scope, what kind of things would you be looking at? We're going to talk about telemedicine, and thanks to COVID, everybody knows about telemedicine and everybody knows about teleconferences, and that's great. But a couple of years ago when I built this course, telemedicine wasn't talked about. Okay, but I was talking about it. The reason I was talking about it is because it's just a habit of me thinking about where EMS can go. Okay. And by that, I mean, I don't see a ton of difference other than pay scale between what a paramedic can do and what a PA is doing. Okay. Other than the setting, to be honest with you, they've got an expanded formulary and an expanded paycheck. But um, as far as assessment goes, as far as technical skill, as far as some of the things that we bring to the table, we're always saying that we are overtrained, underpaid. Well, to a certain extent, that's true, but we're also historically being underutilized. Right. And I think with the shifting policies when it comes to healthcare and cost reimbursement and other things, paramedics are likely to be utilized in a greater degree as a preventative measure from, the health system being inundated. And by that, I think telemedicine and an expanded assessment and kind of a clinical team approach is going to be utilized in the future. Okay, so telemedicine, we're going to talk about that. Um, 12 leads is always an important thing. So I cover that, and 12 leads are a passion of mine. Cardiology in general is a passion of mine, has been for a long time. I've got some former students in here, and they can probably attest to that. But only about a third of the ST elevations that we see have anything to do with STEMIs. Okay, the rest of that ST elevation that we might encounter, that's not a STEMI, but it could be an equivalent. Okay, so I've got some materials that I've built over the years about 12 leads and imposters and equivalents. All right, some things that are just as bad, but they don't have ST elevation. But, you know, we'll go into that when that week gets here. Talking about ISTAT, okay, that point of care testing where we can in the field, and again, taking this back to an expanded scope perspective, I think technology, as it becomes a little bit beefier, a little bit more rigid, sturdier, EMS proof, if you will, using ISTATs is probably something that's going to come up in the future, especially, excuse me, with that expanded scope, healthcare team concept, where we can draw blood and in 2 minutes, 5 minutes, 15 minutes, depending on which test you're running, it can tell you a tremendous amount from basic blood chemistry to ABG kind of information. It's great, okay, but we're not all that familiar with it. We're going to be talking about fast exams. Okay, fast exams is ultrasound, and yeah, most of the time when you think of a fast exam, you're looking for intra-abdominal bleeding. Okay, that's true. Okay, but ultrasound can be utilized for a lot of different things. Less than a week ago, I saw an article. I haven't dug into it yet, but I saw an article about Cherokee EMS here in North Carolina where they were using ultrasound to look for intracranial bleeds, okay, in the field. So if you wrap this into context, that exaggerated scope of practice, that exaggerated ability to assess, which we're already typically good at as paramedics, and giving us the tools and toys for us to go out and do this, we can tell people, you know, what's going on. We can look for that slow bleed that grandma has in her head because she fell a couple of days ago and, you know, she's a little confused or whatever. Okay. Um, some other things, we talked about research. We're going to talk about the expanded pharmacology that you might encounter. But um, uh, what we're also going to talk about is that in its context with that setting. You know, paramedics are being utilized in dental practices. They're being utilized in a lot of different places. So we're going to look at things like that, and then we're going to round it off by looking at how we can interact in the public health sector. And if COVID has shown you folks anything, if you've been working or doing clinicals in COVID, EMS is going to have that expanded role when the next thing rolls around. Um, so those are our topics. Those are the things that we're going to be discussing. And, you know, excuse me for adjusting my computer screen. All right. But um, that's the crux of it. We will discuss more things, and if you have any topics that you want to discuss, we can do that as well. So I look forward to this class. I hope you enjoy it and that you learn something. If you don't, please feel free to complain to me, email me directly. Um, I really want this to be a worthwhile class, but I want it to open minds, not give you death by PowerPoint. All right. So, welcome to 280. Have fun.